3, 2, 1. Arthritis diets. Ladies and gentlemen, Dr. Joel Saylor of Town and Country Veterinary Clinic.
Yeah, good morning. No, we should be getting in that colder weather.
Yeah.
And so now the dogs that have osteoarthritis, or arthritis as most people say, but it's actually osteoarthritis because it's dealing with your bones. Basically, they're being more affected with these kind of conditions. And so a lot of these dogs are on NSAIDs like Deramax or Metacam or Rimadyl, these kind of things. But there's oftentimes a neglected approach, and people do chondroitin sulfate, glucosamine, things like Cosequin, Dasequin, these kind of products, and there is benefit with those. But there's also another approach that commonly gets missed, and it's actually using some of these diets that have been created for help with osteoarthritis. And you say, well, that's crazy. How does that work? Well, they actually work quite well. And actually some of the strongest clinical documentation of success has been with the diet approach. Now, interestingly, the diets don't use glucosamine or chondroitin sulfate because those are not actually approved additives for pet food. So you can't really put them in large quantities in the food to be therapeutic. So if you got a bag of food that says, oh, we've got glucosamine, that's just to make you feel good.
Yeah.
Okay, because they can't put it in a quantity to make it really therapeutic. Yeah. What they have done, N3 fatty acids, specifically EPA in dogs and DHA in cats, are approved pet food additives. And they have added large quantities of those because what happens with that turns off the cartilage inflammatory mechanism. And now it takes probably around 2 to 3 weeks to kick in.
Right. But
when it does, well over 80% of the dogs show noticeable improvement with their osteoarthritis. And there's several varieties out there. The therapeutic ones, like the prescription type diets, JD, and the JM for the Purina, both of those diets have shown good clinical blinded studies to show that they work. Now, Hills also took that JD technology and they put kind of a consumer version out, and it's called Science Diet Healthy Mobility. But if you're out there paying, for chondroitin sulfate and glucosamine, you might want to look at using the diet because it's something that they're going to be eating anyway. Like for a 60-pound dog, the amount, like in JD, it's like them taking 20 fatty acid capsules. It's a huge amount,
yeah.
But it does work significantly. I usually tell people if you're going to try any of these diets, and including the chondroitin sulfate or those kind of products, you want to give it a full 30 days before you decide if it's going to work or not.
Yeah.
Now, I will caution you, if you have a dog that's been arthritic for, years and years and years, and we're dealing with bone-on-bone injury, none of the nutritive type approaches are going to work because they're all predicated on having healthy cartilage or some healthy cartilage to help with the inflammation. So, like I said, it's usually after 30 days. If you don't see positive results, you probably ain't gonna.
Yeah.
Okay, so, but that's an added thing that often gets forgotten. JD Diet by Hills Prescription Diet or Hills Science Diet Healthy Mobility are fantastic diets that are available out there. So if you think that's a concern, ask your veterinarian if that's appropriate for your pet.
All right, and we'll be back right after this.